Hello, we will just wait for everyone to join, just getting myself set up. So hopefully you can all see and hear me nicely. There we go. Let's wait for a couple more people to join. Welcome, welcome. Hi David, how are you? Hi Catherine. Getting myself comfortable and ready to go. Let's wait for a couple more to join. Hi Greg. Good to see a few people joining. Yes, I'm very well, thanks, David. Finished all of my patients and now ready to do the live. So we will get started. Anyone that joins us from now can obviously join and rewatch this bit. So today we are talking about squats. And the things that we're talking about is sort of one, why do we squat? Why is it a good exercise? Why would we want to do that? What muscles are activated mainly when we squat? There's a lot of them. Where are the common areas to feel pain when we're squatting? Common errors when we're squatting, and then what we should be doing. And there is a bit of a practical element to this. If you want to make it a practical element, you can equally just listen to what I'm saying and put it into your gym sessions later on. But you can go through it at the time if you want. And if this goes well, then I might consider doing like a virtual kind of class for this, or we could do something in person as well if people would be up for that, so we can all improve our squats. So why do we squat? We squat because we want to get stronger in our thighs, we want to get more power, because if we're increasing our power by maybe we're lifting slightly lighter weights when we're squatting but we're moving faster, that can help increase our power when we're jumping, when we're sprinting and doing those kind of exercises. It can also help our jump height with that as well. So if you're playing a sport, I play netball, if you can jump higher than the player next to you, the chances are you're going to win the ball on more occasions, particularly as I'm 5'8", that's quite short for a netball player. If I can jump as high as a 6-foot person can, then I might take the ball off them. And also, if we're getting stronger, then hopefully we're going to then be preventing injuries. That's another good reason to squat. People squat because they want to look good. They want to have nice big quads, big hamstrings, big glutes, those kind of things, particularly glutes. That's all in fashion at the moment. So there is a few reasons as to why you might want to do some squats. So when we're thinking about squats, we need to think about what muscles are actually being utilised when we are squatting. And our main ones are our knee and our hip extensors. So at our knee, our extensors are our vastus medialis, our rectus femoris, vastus intermedialis, and our vastus lateralis. And they are all quadriceps muscles. So they're on the front of our thighs. Our hip extensors, that's our glute muscles, and also our hamstrings, but particularly our bicep femoris muscle and our semitendinosus. They're the main ones that we're getting from our hamstrings when we're squatting. Obviously, we've got other movements that come into play as well. We've got our hip adductors, so they're the muscles that sit on the inside of our thighs. Our glute medius minimus that kind of sit at the top of our buttocks as well. They play an important role in our sort of knee and ankle stability. And then we've also got our back muscles and our calf muscles there. All play a role, but I wouldn't call them the prime movers in a squat. So from that long list of muscles I've just given you, I basically said that every muscle in our lower body works to help us squat, and also muscles in our back as well. So that's a huge amount of muscles that we're using, which is why it's such a great exercise. But when we're thinking about pain and why people get pain during a squat, there's a few different areas that people might be feeling pain. And if this is you, then put in the comments. And if you have questions at all throughout, please feel free to put them on there. And if not, we'll also have a little bit of a question time at the end. But one of the common places that people feel pain when squatting is their lower back. And the reason for this could be a couple of different things. And obviously I wouldn't know unless I was looking at someone squatting. But the things that we would want to look at is, do they have too much anterior tilt in their pelvis? So I'll try and show this to you if I can without ripping my headphones out. Anterior tilt is when we're sticking out at the lower back. Posterior tilt will be coming in. So if we've got too much anterior tilt and we're sticking our bottom out basically before we go into a squat, we're really loading up that lower lumbar part of our back before we squat. And that means that a lot of the force, a lot of the weight is going to go through there, and that's not the area we're trying to target. We want more of that to go through our glutes really. So that can be a common reason. Another reason is our chest is coming too low when we squat. So someone's squatting down, their chest is doing this instead of staying up nice and high. And that can mean that then when you're trying to come out the bottom of the squat, you've got to lift your back before you can then come up straight, and that's going to cause you pain. And that is often due to a mobility restriction. That could be at the hips, it could be at the ankles actually as well, that could be causing that to happen. So that's a couple of different things that you want to look at. Other places that are often stiff and sore and tight when we're squatting can be that our ankles might feel a little bit stiff, often in the front of our ankles, and that can be a sign that our dorsiflexion isn't as good as it needs to be. So dorsiflexion, if this is my shin and this is my foot, this movement is dorsiflexion. Me pointing my toes like I'm a ballerina, that's plantar flexion. So if our dorsiflexion, this movement here, isn't that great, that's going to cause us ankle discomfort when we're going into a squat. It can also cause anterior knee pain as well, so knee pain at the front of our knee if we're not getting the right amount of movement there. And when I say right amount of movement, when we do a test called a knee to wall test, which you can have a look up on Google after this, I want to see that you've got more than 9 centimetres, ideally going more to kind of like the 12, 13 centimetre mark to know that you've got good enough dorsiflexion to do squats effectively without compensating somewhere along the chain. And you could also have tight calves that will be causing you to not have dorsiflexion that's as good as we'd like it to be. But other reasons for it as well are previous ankle injuries. It's quite common that people don't get the range of motion back after having an ankle injury if they've not had effective physiotherapy or osteotherapy, chiropractic, whatever you want to go for. But it's quite common to not get the movement back if you've not been managed well. Another place that you might feel pain when you're squatting is around your knee, and that can be on the inside of your knee, that can be on the sort of front of your knee. Like I said before, front of knee can be as a result of the ankle dorsiflexion, but it can also be a result of the tendons that we've got that sit in that area. So that can also cause us pain, and that would be related to a few different things. It could be where you're putting your weight in your squat, and it could be if you've got general technique issues. For example, if we're continually letting our knees kind of come in on a squat, then what can happen then is we get this micro damage over a period of time, and often that will present itself as you thinking, my knee's a little bit sore, but it's not too bad, so I'm going to carry on. Okay, it's getting a bit more sore now, and that kind of pattern goes on for a while until it gets to the point where you're like, okay, my knee's now really sore and I can't exercise. So they're the kind of things that if you notice, okay, my ankles feel a bit stiff, my knee feels a little bit not right, that's when you think, actually, maybe if I go and see a physio now or osteo, whoever you want to see, I can get on top of this really early, because then we can look at it and be like, oh yeah, make these changes and you'll probably be fine, rather than us going, okay, now you've got a full-blown injury and you're going to be seeing us for a couple of months. So, prevention rather than cure is something my mum always says to me. And hip pain, that's another one that we often get with squats. That will often feel more like a pinching pain and can be due to mobility issues. It can be due to impingements as well. And when we say impingement, that can be a functional acetabular impingement, which is one that's caused by bones, but it can also be an impingement where you've got lots of tightness in the muscles around, and that can be causing that too. So again, not something I would be able to say without looking at someone's squat as to why you're getting pain in your hips when you're doing it. Cool. So when we look at our common errors when we're squatting, the things that we tend to see a lot of, starting from sort of feet going upwards. So heels off the ground is a common one that I see a lot. And this goes back to that dorsiflexion that I was talking about before. If you can't get that dorsiflexion as good as it needs to be, our body is going to bring our heel up off the floor and push all of the weight onto the front of our toes in order for us to get that range of movement. And that can then end up with us putting too much weight through the front of our foot and that often causes us to load too much in our knees and that kind of thing. So we want to avoid doing that. So that in those cases where the heels are coming up, we think, okay, how can we, one, address the issue by improving dorsiflexion, and two, is there anything we can do now that means that they can carry on squatting whilst we're fixing the issue? So if your heels are coming up off the ground, I might say to you, what shoes do you wear? And going on from what shoes you wear, I'll be looking for ideally shoes that are a little bit more with a heel. So like your standard weightlifting shoes will often be thinner at the front and they kind of have a little heel at the back. So it's already raising you into that position, but you've got a solid base of support rather than your heel just lifting up off the floor and you having nothing underneath it. If you don't want to spend out the money on weightlifting shoes, then you can do things like popping a couple of small plates underneath your heels, or you can get a triangular, sort of like almost like a mini step thing that you can raise your heels on, which will keep them higher. So that's an easy fix for that, whilst you work on the issues that are causing it, which might be tightness in your calves, it might be a previous ankle injury. And I'm sure some of you have recognised some of the things that I'll say here in yourselves, maybe when you've been squatting. And another one that we see with the feet as well is the feet rolling inwards like this. And that can be because your arches aren't particularly strong, again, possibly due to previous injury. It could be that your feet are a little bit of what people would call flat-footed anyway. But again, can come back to that dorsiflexion range. If it's not as good as it needs to be, then the body will find a way to compensate. Just going to grab some water. The other thing that I commonly see in squats as well, with people's feet, is them being too wide. If you're doing a sumo squat, then fine, but if you're not, then they should want to have the insides of our feet matching up with about the outsides of our shoulders. And then the angle of the feet, I personally don't feel like it's comfortable for my feet to be completely neutral, but that would be the kind of perfect setting for them to be in. But we can have them slightly turned out. What I see a lot of in the gym is people kind of at 3 and 9 when they're squatting, and really we only want about 10 degrees of separation at most. So that's something else that we can look at. When we're looking at the knees, something that's very common to see is that people go down in the squat with their knees in sort of pretty good alignment and they're kind of facing outwards, going over the toes. But as people come up, the knees roll in before standing. And that's going to put a lot of strain on the inside of your knees. And it's also just, you're trying to just use your hip adductors too much. So they're the ones that sit on the inside. And what we need to do for that is practice driving our knees out. And often it can be a weakness in our glute medius minimus muscles. So that's something else we can work on with other exercises as well. Chest coming down to the floor rather than the hips shooting back is a really common one that I tend to see in Pure Gym in Purley, where they're slowly lowering down to the floor, they're kind of losing their mobility at their hips or their ankles, and they do that, and then they have to come back up and stand up. And that can put a lot of stress and pressure on your lower back, so that's quite a common one that we see as well. Another one that I see quite a lot is hip shifts. So people are squatting, but they're clearly putting way more weight through one side than the other side. Again, this can be something that could happen for a few different reasons, but pretty commonly it's, oh yeah, I had an injury last year to my left knee and it was really quite sore for a long time, but didn't do any physiotherapy or any exercise, I just sort of left it. And so over time, one, they've learned not to put much weight on that knee because it's painful for them. And they've also then, as a result of not putting as much weight through it and as much pressure through it, they've weakened that side. So then when you are squatting, you're naturally going to that stronger side. And the issue with that is you're more likely to get an overload-like injury on that good side because you're putting too much weight through it. And as physios, there's a few different ways we can manage that. One, just generally improving their strength. And two, as well, we can use bands and other sorts of things to make sure that people will bring in their hips more centrally. We often see as well lots of wobbling when people are sort of doing heavier squats particularly, and that often comes from people not bracing properly, not bracing their core, not squeezing everything as tightly as they can, and also people not breathing properly. If you're not taking a big deep breath into your belly, kind of like a belly breath and holding it, and you're lifting a heavier weight, you're not going to have that intra-abdominal pressure to keep everything nice and stable. So there are a few of the common errors that we see as well. When we're looking at what should a good squat look like, there's lots of different things, and that's why I think it would be good if you are able to have a little stand up in your living room or wherever you're watching this and try it for yourself, then you might feel the differences. And you'll probably feel as well, if you do implement some of these either now or in the gym, that you're like, oh, I don't really like this feels a bit weird, because it's something that you've not really paid any attention to before. And as soon as you do it more and more, you'll feel like, okay, this feels good. So we want to start with looking at the feet. So one, let's talk about what footwear we should be wearing. I kind of touched on this briefly before. Lots of people think we should be squatting barefoot. For some people, that's absolutely fine. But for a lot of us, we don't have the dorsiflexion range. This is the word of the day, isn't it? And two, the foot stability as well. So if your arches are a little bit fallen, which for example mine are, if I'm squatting without any shoes on, the chances are all that's going to happen is my feet are going to roll in slightly, and I'm going to be putting loads of pressure on the inside of my feet and on the inside of my knees. So if you have got really good dorsiflexion range and you've got very solid feet sort of arches and stable arches, then squatting barefoot for you could be okay, but for a lot of us that's probably not going to work. And in those cases as well, if you like squatting barefoot, you feel like you're more comfortable, you could do a couple of warm-up sets barefoot, but as soon as you go into your actual weights that you want to lift, then you can put your shoes on, because then in your warm-up sets, you've got a little bit of proprioceptive feedback, and proprioception is knowing where your body and your joint is in relation to space. So you've got a little bit of feedback from the floor to your feet, and then when you do your actual sets, you're putting your feet into a nice set of shoes to help you. Then when we are looking at shoes, if we sort of take a standard running shoe, for example, it's going to be nice and padded and nice and foamy, because when we're running, we want to be able to put as little kind of pressure through the Achilles basically as possible if we're going on long runs. So we want it to be nice and absorbent. But the problem with those kind of shoes is if you're wearing them in the gym, then if you've got your foam padding here and this is my foot and this is the bottom of my shoe, as soon as I'm pushing down at the bottom of that squat to come up, I'm just compressing that foam before I can then come up again. Whereas if you've got quite a hard base shoe, I'm already there, I can already push back up. So that's what you want, is a firmer shoe. If you've got good ankle range of motion, there's something like Nike Training, they do some really flat ones. Ones that I personally really like are Nike Metcons, because they're really flat, but they also give you the option of like a heel raise, a 6mm one that they send to you with the shoes as well, and you can wear them for lots of different things in the gym. And if you want to go the whole hog, you can get some nice weightlifting shoes. I've got some Adidas ones, but I think Reebok do some nice ones as well, where you've got that heel that I sort of mentioned before, so it slopes down, so then it puts you in quite a nice position during squats and deadlifts. Other things to note with the feet. So this is where I want you to get up and give it a go. Have a stand up, and I want you to imagine that your foot is a tripod. So you've got your heel, the base of your baby toe and the base of your big toe, and they're the 3 points of your tripod in your foot. So I want you to have a go at standing there on both feet and just trying to push those bits really through the floor and see how that feels. Because a lot of us would have been told, when you're squatting, put your weight in your heels. That's where the weight should be. To a certain extent, yes, we do want it in our heels. But if we're putting all of our weight in our heels, the front of our feet are going to be able to come up a little bit. And the issue with that is a lot of our power comes from our big toes. If we're not utilising that, then it's just wasted. So we really want the weight to go over the middle of our foot, and the best way to do that is to create this tripod position with your foot. And as a drill to practice squatting, you can do that standing on a single leg, and you can really think about all the paces that you're pushing. And like I said, this is going to feel alien to you when you first do it, but it's something that you'll get used to when you're squatting as well. So I think that'll be something that's really good for you to try. And with all of these things as well, it's essential that even in your warm-up set, you're acting like this is your biggest lift. So you're still putting all of these technical things together so that when you do get to those bigger lifts, those movements they feel really natural to you, and it's something you've already been practicing. Touched on this briefly before, but foot positioning, we want to have the insides of our feet matching up with the outside of our shoulder. So that's about how wide you want to go. Want our feet either straight or slightly turned out, about 10 degrees, but no more than that. So they're the main things we want to look at with our feet. With our knees, we want our knees kind of in line with our toes pretty much. So as we squat down, our knees not necessarily go over our toes, but they are in line with rather than coming in. And there's a big myth that I need to bust here, is that knees can't go over toes when you're squatting. That myth basically came along from one study that said, if you put too much pressure through your hips when you're squatting, by putting your knees over your toes, then what's going to happen is you're going to put, they said something like 8 times more pressure through your hips. So everyone said, okay, no, your knees can't go over your toes. What they don't realise actually is that by putting knees over our toes, it's not dangerous at all. If that's a squat position that you're kind of used to and you're comfortable with, it's fine. So that all came about from one study and actually isn't something that we need to be that concerned of. There'll be lots of power lifters if you watch videos of them, or Olympic lifting, that's the one you really want to look at, where their knees are well over their toes in their squats and they have no injuries and they're completely used to it, and it's something that they've trained to do. And if you watch really young children squatting down to play with things, same thing, their knees are over their toes. So you don't need to worry about that. You want to make sure that your hips are shooting back when you squat rather than trying to go kind of straight down. And you want your back to stay up nice and straight, and you want your chin to be coming slightly upwards as well. And if you're doing this with a back squat, you'd want to see that the bar path is following a line. So as you squat down, you can pretty much draw a line where the bar is. What we don't want to see is you squatting down and seeing something like that with the bar. The bar path should stay quite straight. So they're the kind of things that you want to be looking at when you are squatting. But I also want to go through the setup. So for this setup, we'll think of a back squat, which I'm hoping most of you have done. Put in the comment section if you have done a back squat before. So a back squat would be where I've got a bar on my back and I'm holding it either side. So when we're approaching the bar, what we want to do to start with is set the bar up so it's somewhere halfway between about nipple height and shoulder height. Anywhere in that kind of region is fine. You're going to create a trap shelf. So you've got your trap muscles here, and you're going to get the bar and you're going to squeeze your shoulder blades together so you can put the bar on top of it. We see a lot of people in the gym, I should have put this in the common errors section, squatting with pads. The pads are for hip thrusting. The pads are not for your shoulders. As soon as you're putting pads on your shoulders, you're creating a really high bar back squat, and what that's going to cause is your heels to often lift up off the floor, because if you don't have that ankle dorsiflexion range of motion, then it's going to cause you issues. So we're definitely not using a pad on our shoulders. We are, Matt back squatted once or twice. I think you back squatted quite a few times. Matt, for anyone that doesn't know, Matt squats ridiculous amounts of weight in the gym. So when you're setting up for your squat, you're going to make that trap shelf. You're going to get your hands kind of either side of your shoulders, on the outside of your shoulders, and you're going to bring your elbows through. So your elbows should be in line with the bar. What we often see, if I go to the side, you might see, is when people are squatting, their elbows are back here somewhere, trying to hold onto the bar. Elbows should be underneath so that they are in line pretty much with the bar that's on our shoulders. So we've already created a lot of tension through our upper body, and what I want you to do to create even more tension is to actually pull down on the bar. So then we're really activating our lats and all of our trunk muscles in that area to create a really good, strong sort of support base, really, is particularly for when we've got weight either side on that bar as well. And then what I want you to do with your feet is, like we said before, creating that tripod foot positioning. They're going on the outside of our shoulders, the inside of the foot matching up with the outside of our shoulders. And then I want you to imagine you're trying to rip the floor apart. So if this is the floor here and your feet are there, they're ripping the floor apart. Because as soon as you're doing that, we're externally rotating our hips. We're forcing our glutes to fire up, which are our big powerhouse muscles that help us get up. They're anti-gravity muscles. They help us get up from a seated position, help us get up from a squat, help us get up and down the stairs. And you're really activating them by doing that. And then you're going to take a deep breath in, and a breath in that's going to go to your belly, basically. It's not a breath in where we're trying to make ourselves look skinny for like a picture that one of our mates has taken. We are holding that breath into our stomach so that we're creating intra-abdominal pressure to help protect us and to help keep us nice and strong and stable. So you're going to hold that breath. You'll then be picking the bar up. You have to take a few steps back, put your feet in the right position. And then you're going to lower down to the floor, not worrying if your knees go over your toes, but making sure that your knees don't come inwards at all, keeping your back nice and straight as you go down and hips backwards. So that's the kind of things that we want to be looking at when we're setting up for a squat. So I know I've mentioned quite a few different things there. So if you weren't taking notes, you might want to re-watch the video again. But yeah, there's quite a few things there for you to think about. And particularly as the heavier that you start to lift, the more these things become important. When we're just doing body weight squats, if we've not quite got the technique right, we might get injured if we're doing lots of them. But if we're not doing too many of them too regularly, then it probably isn't going to matter too much. But as soon as we're loading up that weight with lifting our own body weight on our backs, or double our body weight depending how strong you are, that's when we're opening ourselves up to the potential for injuries if our technique isn't good. So if you have had any injuries from squatting, or you're wanting help with how to improve your squats, or you've got a few issues or things don't feel comfortable, then please feel free to comment on this, or you can DM us with any questions that you might have and we can see how we can help you. But before then, I want to see if anyone's got any questions related to squats or any pain that you've had during squatting, or if you've just tried some of those techniques in your lounge and you're not sure on anything, then put a little message in the comments and we can discuss it. And the other thing to mention as well is there is quite a few different types of squats. So I was sort of talking about the setup for a back squat there because that's the one that we commonly see in the gym. But we have got goblet squats, which is where you're holding a weight in front of you. And this is the one that I would always get my patients to do who haven't squatted before, haven't squatted in a while, or get in pain when squatting, because it forces you to have slightly better technique. If I'm holding the weight in front of me, I can't tip forward because I'm going to fall forwards. So it forces me to stay nice and upright with the weight, and therefore sort of helps with that squatting technique. And the order that I'll generally teach squats in are goblet squat, and then front squat where you're holding it here or like here, this, and then back squats. But we've also got Cossack squats as well, but again, they're working kind of slightly different muscles. We've got split squats. So there's lots of variations on the theme, but that setup that I was talking about could be applicable to front squats too, to a certain extent, but sort of we're bringing the elbows in line. We're mainly talking about back squats. Cool. I don't think anyone's got any questions, but if anyone thinks of anything after this, you can always put a comment on this video, or you can send me a message and I'll get back to you. Yeah, any feedback, let me know. Brilliant. Thank you so much for joining. Bye.